Dr. Elissa Kennedy is a part-time volunteer working at the Reuben Clinic, which has been completely redeveloped by the Edmund Rice Foundation.
I will do. The slum out there can be full of misery and despair, and it's awful and people are suffering, but by the same token, there's so much life and hope and resilience out there, and you know, people battle to survive, but they hope for so much more. The staff are amazing. I mean, when I first came here, I knew absolutely nothing about absolutely everything that goes on out there and in here. And when I think back to it, I was so naive. And they not only welcomed me, but eased me through those first couple of months, taught me everything they knew so that I could get to a position to then teach them everything I knew. And anyone in the family with the same problem?
Kuna mtoto kwa familia amekuwa na shida kama hiyo.
Okay. So this one should go away on its own. But it may take some time. You're going to be a doctor. Has she been putting on weight?
She's probably
2 young.
2 young.
Okay. We might have a quick look at her if we can. Well into that. Okay. Even for children we would consider normal weight here, they're still not getting the nutritional intake that they need. We need to give them as much help as possible. We just make a really good working team, and when I'm not here, which is most of the time, they carry on and do such a wonderful job.
I see general patients with all kinds of medical illnesses. The minors could be having things like malaria, typhoid, cuts, minor injuries, fractures, could be having HIV, TB, pneumonia, and respiratory tract conditions.
The overseas aid is very important because of the clients we serve here. We have those who absolutely cannot pay, and they are identified by the social worker. Then we have those who can pay a bit, and we subsidize. So without aid, it cannot be sustainable. We cannot be able to offer all the services that we are offering. Most of the services, other than the curative, are free.
The brothers began the project in the year 2000. So there was a brother here before me, Bob Aaron, who had done a lot of pioneering work.
Barry Kellen has taken up the running now and I think has moved Reuben to a different level.
He is a brother, a father, a friend, and willing to help in whatever way he can.
What I have found great with him is he likes the people from the slum, and most of the time you meet him out in the slum just alone, just going to visit them from house to house.
One of the good things that the brothers did when they came in 2000 was to have a police post built here. So since the police post has been built, there has been a very good control over the violence and other activities that were going on before that.
Every few minutes you hear that somebody has been attacked outside.
Sister Mary is incredible. I mean, when she came to this place, it was on the verge of closing. Back then it was a tin shed.
I have a good team. They have a passion for the work. They're very committed.
We see hundreds of patients a day. It's not just handing out tablets, it's also about putting out a health message, helping people through all crises in their lives. We look at issues of poverty, so food, shelter, helping kids get into school. They run preventative programs now, so they look after women who are pregnant. We look after children who are under 5 with free vaccines. They give comprehensive care for people with tuberculosis, for HIV. She's made a huge difference.